Hi, everyone. Thank you so much for having me today for a virtual talk. My name is Russell De Jesus, and I'm a doctoral student at the University of Utah. I'm also the IDDSI Philippines reference group leader. The IDDSI Philippines reference group is part of a larger team of volunteer clinicians. And so as a volunteer, I don't have any disclosures. But in the same team, we have the Japan, Myanmar, Taiwan, and Hong Kong reference groups. They call us the IDDSI Asia reference group for the International Dysphagia Diet Standardization Initiative. So for the past few months, IDDSI Asia has been collecting data, analyzing sticky rice. We call it the Sticky Rice Project. Thank you again for the opportunity to present our findings. To get started, I wanted to briefly recap the IDDSI framework. So the IDDSI framework describes a lot of food texture modifications and drink thickness modifications as well, from zero or thin like water to regular like dry foods like crackers and bread. And for the most part, I feel like the IDDSI framework does a great job at describing different food textures or drink thicknesses that we can make. And we can make these foods safe for with dysphagia patients in mind, people who have a hard time swallowing after a stroke or a neurological deficit, etc. But like I said, this does a really good job standardizing the way we communicate across different clinics and hospitals and across different fields with how we modify these foods and drinks. But there are still some gaps, especially, for example, with how we describe rice. Rice is notoriously difficult to swallow because it's so small and sticky. Um, it adheres to our mucosa, even when we don't have dysphagia. Um, and I believe that these gaps are a result of the different forms that rice takes. There's a large variety of the forms that rice takes. That includes congee or rice porridge. There's sticky rice desserts. So rice cakes is how you'll hear it referred to a lot. Um, there's also dumplings, so pretty much rice wrappings filled with various foods like meats or beans and etc. There's also noodles and fufu and other related foods. In fact, rice can even come less cooked, right? Less steamed, I should say. There's, for example, kaukua, which is glutinous rice that's been toasted and ground up very coarsely, and you use it to top foods to add a little bit of crunch to those foods. There's also puffed rice dishes, for example, for cold cereal or for snack crisps. And I'll discuss some of these in a moment here. Like I said, rice porridges were a gap in the IDDSI framework. Um, However, a lot of Asia regional groups or reference groups have come together to create this document on this website here on the first bullet point, so idsi.org. And you can find this document and download it for free. And in this document, they discuss how we manage rice porridge and congee. So the first thing that they do is they defined rice porridge. The way they did that was they listed examples from different cuisines. So Taiwanese, Cantonese cuisine, Chu Singapore, Malaysia. And as you can see on the top right, those pictures there, the spoon tilt, fork drip, and fork pressure test, there's some chunky rice porridge there. At the bottom is some pureed congee. It's a little more smooth and lump-free. And those are the different IDDSI levels with the spoon test and all of that. So this document defined rice porridge, and they mentioned that rice poses a special risk to people with swallowing difficulties. And then they also defined the modifications, levels 3, 4, and 5, using the spoon and fork tests. And then they included some case studies as well. So you can see on the screen here, we have fees and a fluoroscopy. The fees is a 65-year-old male patient eating congee with a left basal ganglia bleed. The patient also presented with right hemiparesis and lost most of his molars. And so there was poor orolingual control and inadequate bolus formation. So what they found during this swallow study is that this patient had a delayed initiation of swallow. There was some penetration and aspiration of the rice granules, and they observed some post-swallow residue on the valleculae, vestibule, and piriforms. You can see that in those 4 images on the left. On the right is a fluoroscopy of a 73-year-old female patient with a pontine CVA, history of multiple strokes and deconditioning. They placed an NG tube, and the patient was looking to increase her repertoire of safe diet textures. She wanted to expand beyond her restrictions. But they observed some weakness in her oral muscles, and she also didn't have any teeth. She was edentulous. And so what they found during the study was some reduced mastication and food manipulation. She did take softer textures. She was okay with those. She had poor control of fluids and a delayed swallow, excuse me. She had delayed swallow triggers, and incomplete airway closure and reduced base of tongue strength. So she had an increased risk of aspiration, especially with rice, even with small amounts of gravy. And this makes sense because that is a mixed consistency. Thick porridge without excess fluids was significantly reduced, her dysphagia with thick porridge, because this kind of consistency was more cohesive in the bolus during the swallow. So you can see there's lots of ways to circumvent or address these swallowing issues when modifying rice porridges. Okay, but what about sticky rice dishes? First, we have to ask ourselves, how diverse are sticky rice dishes? What counts, what doesn't count, right? If we look at it from a cultural perspective, humor me for a second, but does pureeing a dish still count as that dish, right? Culturally, if we're going to be culturally competent, does pureeing a dish still count as that dish? Are patients going to be familiar with that dish? And then on the other hand, clinically, does a minced and moist dish actually make that dish safer to swallow? These are some considerations to make. And so with those in mind, we wanted to ask, what's currently being practiced? How can we modify these sticky rice dishes, right? How can we modify their textures? And how does the bolus behave once they're modified? So we'll start from the beginning because it's difficult to capture the diversity of sticky rice dishes. Okay, so glutinous rice. Glutinous refers to being gluey, being sticky, not gluten, not gluten content. It actually doesn't have a lot of gluten content. So that's kind of a misnomer or a misconception about glutinous rice. It's not the gluten, it's just that it's sticky like glue, glutinous. And the specific cultivar we're talking about here is Oryza sativa glutinosa. There are other varieties out there, Japonica, Indica, Javanica, even Arborio in Italy, right? Sushi rice, short grains, long grains. Um, but the thing that sets glutinous rice apart, this Oryza sativa glutinosa, is low amylose content. In fact, it's very low. It's less than 4% amylose content, and it does have high amounts of amylopectin as well, but it has low amylose content compared with other strains. Even sticky short grain rices have about 14, 10% amylose content, but Oryza sativa glutinosa or glutinous rice has less than 4% amylose content. So another thing, another characteristic of glutinous rice is that a lot of times, unless you're in Laos or in Laotian culture, the way that we cook it is either in its granular form, so it's in grains, or it's milled into flour. And we cook it by boiling it in some liquid and then cooking it a different way afterwards. So these are hard to swallow because they're sticky, and they're really sticky because they have a really low amylose content, less than 4%. So what we did was we sent out a Google Forms survey. We received responses from 22 clinicians from 13 regions, and these were the questions that they were asked. First, we introduced the survey. Glutinous rice dishes are a traditional part of many cultures. However, because they stick and clump when swallowed, they pose a special risk to patients with dysphagia. And then we described what the short survey was going to do. And the first question was, what region do you or your patients represent? Like I said, there were 13 regions represented here. And here, number two, what are some traditional sticky rice dishes that you're familiar with? Okay, we didn't get an exhaustive list of sticky rice dishes, and I can't pretend to know how to pronounce some of these names. I'm from the Philippines and from the United States. And so that's the background that informs the way that we have conducted this survey. Okay, but think about the implications. I'm going to show you some pictures and think about the implications of the cooking methods and the serving methods and the way that these dishes are described. Think about the implications of those things on the way that the dishes are swallowed. So first up, we have this niangao, which is a Chinese New Year cake. It's essentially a cooked dough or paste, right? So you take the powder, the flour, and you add liquid to it and you cook it as the dough, right? And then you fry it. And that's what you're seeing here is this delicious looking crust. Sometimes it's garnished with syrup, so they put syrup on top or sesame seeds sometimes. Right here we have mochi, which is a classic example of a glutinous rice dish. It's a cooked dough, it's steamed, it's sometimes filled or garnished, right? Here we have fantuan, which is, you can see the grains here. This is different from mochi because you can see the grains clumped together. And this has been also steamed and stuffed with a filling of a different consistency. Here we have badak benderam from Malaysia, which is a doughy consistency again. It's been steamed, filled with something soft, typically beans, I believe, sweet beans. And I included this because it's served in coconut cream. You can see some, there's green balls, but underneath you have other balls that are immersed in a liquid. I would say that's probably IDDSI level 3, maybe 4, the liquid. Here we have a Filipino delicacy. It's called suman. from the Philippines, and you can also see the clumped grains there pretty easily. This is, I know how to cook this actually. So you take the glutinous rice and you boil it in coconut milk or coconut cream, and you mix that, and you actually take the mixture and you put it in banana leaves. You wrap it up into this log, and then you steam that, right? And then you serve it with this sort of sugary, really buttery syrup, and sometimes coconut shavings on top as well. Um, we have this. This is different because yes, it's a glutinous rice dish from Vietnam. This is called bandalon, and I will call this jellified or gelatinized because a lot of times sticky rice dishes like this that are layered and steamed were also treated with alkaline solutions like lye. We have something similar in the Philippines, sapin-sapin and kuchinta. They're more jelly-like, and they haven't lost their stickiness, but they do have a little bit of a different consistency. Some sticky rice dishes like this khao lam um, are roasted in bamboo, and they are granular as well. Sometimes they're mixed with beans. And I believe dishes like this are pretty popular across Southeast Asia, Indonesia, Malaysia, and the Philippines. But like I said, you can mix in sweet beans or fruit or meat in with the rice before you roast it. And these are all of the ones that I've found. You can notice there's probably hundreds of these dishes, just sticky rice dishes. And I went through and painstakingly selected ones that met a lot of the criteria that were similar to the pictures that I showed you, right? And so there's foods from Korea, Japan, Nepal, India, Bangladesh, China, Hong Kong, Singapore, Taiwan, Laos, Myanmar, Cambodia. And here's some more that I found: Thailand, Vietnam, Malaysia, Indonesia, and the Philippines. And you'll find there's crossovers between a lot of these dishes, and there's also some differences. I'll talk about things that we're going to exclude from the project. We're going to exclude rice puddings like arroz con leche and torta de riso because these are either uh, congee or rice congee-like, or they're made from non-glutinous rice. Torta de riso is made from arborio rice. Even though these are sticky, they don't have that low amylose content. We're going to exclude baked rice like the tahdig from Iran because these are a little heterogeneous. We add a lot of mix-ins, meats and nuts and olives sometimes, and they're not as adhesive. They use long grain rice for these. Spongy cakes. We have vitumbua and masa and idli and puto from the Philippines. And these are more like bread. A lot of these are fermented or allowed to rise by some other means. And they crumble in a different way, even though they're soft and moist sometimes, they crumble in a different way than what you would expect from things like mochi. Puffed rice cakes like Rice Krispie treats or Rice Crisp discs. We have pucks of Rice Crisps in North America. We also eat a lot of puffed rice cold cereals. There's shanbei from China, jipang, and inang inang from Malaysia. These are all crumbly or cracker-like, even if they're sticky because they've been infused with honey or other sugars. And we'll also exclude these other sticky rice dishes. Just know that we're aware of them, but for this project, we're going to exclude them: fufu, cassava cake, and tapioca pearls, jelly, sago, agar-agar, and gelatin. Just because they're not made of glutinous rice, or if they are, they're mixed in with other ingredients, and they increase the amylose content. Glutinous rice, again, has less than 4% amylose content, which is what makes it so sticky. So what do these dishes have in common? Low amylose, like I said, but there are 5 little criteria that make these ingredients or these dishes that have something in common with these dishes. So the consistency, some of these are clumped grains because they've been cooked in coconut milk or something. And so you can see the grains, but they're clumped and they're sticking together. There's also cooked doughs and cooked jellies. I don't know if you can see this, but Zoom wanted to raise my hand, but I'm not raising my hand. I'll move on. The cooking method, right? They also have a common cooking method. Most of them are boiled or steamed, and then they're roasted, fried, or steamed again, or boiled. When they're boiled in a sort of liquid. Excuse me, let me go back to jelly here. Speaking of jelly, when it's gelatinized, again, it's a little bouncier because it's been treated with alkali. Let me see if I can unraise my hand here. It's okay. For the sake of time, I'm not going to unraise my hand. So the third thing that they have in common, the third criteria, is fillings or mix-ins. Not as important because a lot of these dishes can be eaten by themselves. There are also aromatics you can wrap these sticky rice dishes in banana or lotus leaves, or you can infuse them with essences from pandan or even banana essence sometimes, and serving. They can be served alone or with other ingredients on top or with entrees, right? Or you can serve them in a broth, liquid, or syrup. These last 3 fillings, aromatics, and servings, they're not as important as the first 2, the consistency and cooking method, because of our considerations for the swallow. Okay, so those are the dishes that our clinicians are familiar with. Oops. And now, what are their recommendations, or what have they recommended to minimize choking hazard? Well, we asked them that question, and they were allowed a short answer response, and these were their responses. There were 5 mentions of adding more liquid, 9 mentions of reducing the particle size, 4 for altering the cooking method, 5 for substituting ingredients, or 4 for substituting the entire dish, and 10 mentions of avoiding. Adding liquid, some recipes already call for coconut or ginger syrup, but perhaps there might be an increased aspiration pneumonia risk because syrups do tend to feed bacteria. Or adding more liquid could be a mixed consistency and more complex to swallow. One person mentioned liquid washes, and with liquid washes, that's definitely a strategy that we use already. So take small bites and then wash it down with some liquid. Reducing particle size. This one, I believe, could be split up into 2 subcategories. Smaller pieces, which there are 1, 2, let me see, 1, 2, 3, 4, and 5. There are 5 mentions of breaking it into smaller pieces. And then there are 1, 2, 3, 4 mentions of pureeing the sticky rice dish. Now, there are 2 negatives here. does not usually recommend pureeing, or it's hard to moisten or mince. And so there is a consideration of level 5. Minced and moist may not exist because of the granular nature of the rice, if it's a clumped grains type of sticky rice dish, or the stickiness of the product could prevent it from being effective as a minced and moist. It could possibly be a congee style type of dish. But also, if we modify the foods this way, are they still the intended traditional forms? Okay, altering the cooking method was the third theme that we found. Okay, and there were 4 mentions of this. So essentially, overcooking it might make the dish softer. Substituting ingredients. You could substitute less sticky ingredients. For example, jasmine rice or yams. Enzymes might make it a little less sticky. Trehalose and oral nutrition supplements we could be used to boost the nutritional content of pureed foods. And then substituting the entire dish completely, because there are non-sticky snacks that they could have that are easier to digest and to swallow. But something to consider is sticky rice altogether dangerous? And what does the patient want? And finally, the last theme, the 6th theme, was to avoid sticky rice completely. So some people remove it from the menu, or they recommend the patient to eat less or avoid it, or they inhibit the patients to eat the sticky rice cakes. These 22 clinicians were generally hesitant to recommend patients any rice dishes. One of them said sticky rice is too tricky of a consistency for dysphagia patients. They're referring to the way it's prepared and the way that it's swallowed. Another clinician noted that mixing pieces of sticky rice dishes into soups could increase the complexity of food, because now you've got a mixed consistency item. And then finally, a lot of these modifications could make traditional dishes unfamiliar, and that might result in patient non-adherence or attrition from our recommendations. We already see that. And so there's absolutely a need for the framework, the IDDSI framework, to address glutinous rice dishes. And that's our study. Here's the limitations of our study. That it doesn't represent all the traditional sticky rice dishes. And there's probably other texture modifications we haven't discussed or that we didn't receive in our survey here. And what about IDDSI level 5? Is that just a congee style modification, or is it something else altogether? And so we are currently working on a spoon and fork test. That's what we're recording right now. And so for future directions, we'll define IDDSI levels 3 through 6. Okay. And we would really love to describe the way that the bolus behaves during the swallow for different IDDSI levels and different categories. Remember those criteria that we described, the different categories of sticky rice dishes. And we can use imaging like FEES or fluoroscopy to describe these bolus behaviors. We're currently in the process of applying for IRB approval to do this imaging. And so Thank you so much for having us present our findings so far. I know this is still preliminary information with the survey and the thematic analysis, but again, thank you so much. And if you have any questions at all, you can email me at philippines@idsi.net. I hope you enjoy the rest of the conference.